Basically like this area down to the top of my belly button.
What do you feel there?
Tightness. Yeah.
And how long has that been? Was that
Well,
before the accident or was that?
that was after the accident.
Okay. So what I'm doing here is we're going to work here, Nick, on the diaphragm
Yeah.
and solar plexus. The diaphragm has a lot to do with breathing, as you realize.
Yeah.
It can also affect digestion, though, too.
Yeah.
And I find restriction in here.
Yeah.
A lot of times people have problems with acid reflux.
Yeah.
Solar plexus is like the core of the body in terms of balance and health and movement as far as body alignment, but also core in terms of health because it's the main blood, nerve, and lymphatic center for the upper digestive. So what I'm going to do is I'm going to just hold here on either side of your rib cage, and I'm going to slowly stretch it out.
Okay.
Sort of like stretching a piece of stiff, like rubber band or some exercise band that you're trying to stretch out. And breathing.
Deep breaths.
Yeah, nice deep breaths. So I'm basically a holding force against your breathing.
That's right. Gravity too.
And gravity. And every time you let out, I hold it there. And then we can go a little further. Yeah, a little more tightness on your right side than your left.
Yeah.
Not too bad.
And I can feel that.
Now, on a 1 to 10, with 10 being the most, how much discomfort do you feel?
At the moment?
Yeah.
Not
Not too bad?
No, not too bad.
A couple more breaths. Okay, next I'm going to work on the solar plexus. So here I go between your, just under your rib cage and your belly button.
Yeah.
Straight down pressure. Same thing, nice. This feels a little tighter, so it could be a little more tender.
It is.
So 1 to 10, how much pain initially here?
No, it is a little tighter. It's actually, it feels good.
Medicinal. And that's part of the goal we're looking at for physical medicine is that it should feel like a good tenderness or like that part of the body needs some attention. This area of the body is an area that we always try to protect because it's more vulnerable. And sometimes when we have injuries, there can be an emotional component. And I've had it where as I'm doing or after I do the technique, sometimes people have feeling of sadness or tearing in the eyes. Sometimes they'll have memories of the trauma that they experienced in the past. Probably one of the most interesting things too I've seen from doing this particular combination of two techniques is that I've had a number of patients that have had problems with acid reflux and on prescription medications for it, and after half a dozen treatments, they're either able to greatly reduce, if not get off the medication.
Right.
So it's actually shown me that if this mitigates and eliminates a problem that the person's had for months and years, despite being on medication, that there's a big structural component oftentimes with a lot of individuals. And this gets locked up, basically you can get sort of like, I look at a local Charlie horse
Yeah.
after you get the wind knocked out of you. So that's why any major accident, history of abuse,
Mm.
any individual that's been assaulted, this area will certainly tighten up. And some people just naturally hold their stress.
Mm.
This is a common area.
Mm.
We use in our vocabulary that I just can't stomach that.
Yeah.
Or stomach a situation.
Yeah.
That's, we feel with our gut.
Huh.
So the goal is just like with other areas of the body, is for the tissue to get softer. And I'm feeling better release lower than in the upper area here, so still some residual here. So that usually tells me that I'll need a few more treatments until both hands end up feeling an equal amount of elasticity or relaxation. Okay, so why don't you sit up here for a minute? So we did this one time before, so
Yeah.
tell me what you're feeling or what your experience is. What did you?
Well, trying to think of an analogy for it. It's almost like I had a rock stuck in my gut, and it would get so painful that it almost would travel around. It would travel around to my kidneys. In fact, my dad, who's in his 70s, he's had the exact same kind of symptoms since he was 4 or 5 years old.
Wow.
His dad was a doctor, so he'd just give him, Percodan back then,
Yeah.
And he still has it to this day.
Yeah.
It is
A lot of kids have it. A lot of kids, they used to call it colic for the individuals.
Right.
Like when they would breastfeed and you burp them a little,
Yeah.
toddler, and they throw up, and they seem that they, throw out half of what they
That's
take
right.
in.
Yeah.
And so they used to call it colic. Now they're calling it acid reflux, and they're putting infants and toddlers on antacids at that age. And and so this is common. I commonly see infants and toddlers with the same thing.
I've tried Prilosec, and it didn't do anything for me. The last time when I went home, my back, I know is not going to kill me. Your insides and your guts, your organs, that emotionally in my brain scares me, because you don't know. I don't know what it is. I mean, is it liver issues? Is it kidney issues? And then when you do that when you do that procedure, it's like my mind and my eyes like open up, and it's like my brain, it changes. It does something to the brain. I don't know what. The only way I can describe it is if you're a surfer, you go surfing, and it's like when you're done surfing, you have a rush of endorphins, and you love it, and that's like after this procedure in particular, that's how I feel. I'm just happy, and it's taken away the pain. The pain was has been really intense.
And that's the goal of physical medicine, is to release endorphins. And like you explained it very eloquently, is that oftentimes even when I'm pressing on this area, if it's really a big area, even if a person doesn't feel discomfort right there, they'll feel it radiate to the back or radiate down into the abdomen.
Yep.
Another thing you touched into is that emotional feeling. A lot of times I notice people that have panic attacks.
Yes.
That'll be part of the process.
Yeah.
It would be that or something in the ribs
Yeah.
locked up in there. Because when you're it sort of chokes the breathing.
Yeah.
And that choking of the air has a big effect.
Yeah.
And in fact, one of the things I bring out is posturally is we have sort of an accelerator and brake in our body,
Yeah.
just like in a
That's
car.
right. This and this.
So right,
Yeah.
so the accelerator is when you have good posture, shoulders back, you know what you like to,
Thanks
you
for
know, the
reminding me
surfer,
about that.
the surfer position.
Yeah.
So good posture, you're opening up all of the oxygen to the lungs,
Yeah.
maximum circulation of the heart and digestion.
Yeah.
If we get more like this, we're putting the brakes on. It's almost like we're compromising, we're cutting off the blood to the heart, cutting down the oxygen to the lungs, less
Interesting.
intake, slowing down digestion, cramping up digestion. So yes, so that's really the big important aspect of getting all of this tension released.
Yeah. I mean, it's changed my life in a nutshell.
In a positive way.
Beyond positive. It's hard to describe.
Yeah, last thing
You
they
know,
put
the
in.
emotional thing you're talking about.
Yeah.
You know, I feel it every time, especially when you do this area, particularly this area, because my back, yeah, it's pain and I that kind of stuff. But for some reason, this area, it's like, oh, I'm not dying, you know, and that is, I can't speak for everyone, but I would imagine a lot of people, when they have that kind of constant turmoil in their gut, it's a very scary thing. You know, you wonder what's going on.
So you're probably not surprised to hear that some people call the gut the second brain.
Yeah, not at all. Not at all. It's crazy. And it's what's crazy is this ping pongs off of my spine. So as this releases, my spine starts to feel better, or at least my back. I shouldn't say my spine. My back starts to feel better.
Well, both, you're right. Well, the big muscle that goes through there is the psoas muscle. The psoas muscle is one of the biggest muscles of the body. Other than the diaphragm, it's one of the few muscles that you can actually see on an x-ray. It goes from the groin in here on an angle, about like this, to the diaphragm and the middle back.
Okay.
So when we release some of that tension,
Yeah.
that's why you feel less pressure in the back.
Oh, one thing I wanted to mention actually was after our last session, it's kind of embarrassing, but like I never burp, ever. I mean, it's rare. And I was burping, like my wife was like, what was that? I had never had this much gas or burp or whatever come out of my stomach. And it lasted for 3 days. And every time that happened, my stomach would get looser and looser, like in obviously a good way, which was interesting.
Yeah, part of what you experience is what I find when you're working on the connective tissue and the mild and the soft tissue, what happens is it sets a cascade of opening things up allows a cascade of healing to occur.
Right.
And so the treatment, it's sort of, I look at it like irrigating a plant or opening up, when you open up the healing process, it just keeps on evolving on its own. And so that's part of the goal I have for treatment is to get the healing ball rolling, let's say.
Yeah.
And then that's one of the ways I figure out when is a good time to see the person again.
Yeah.
When things kind of start slowing down. So initially, I like to see a person on a regular basis, sometimes once or twice a week to get the ball rolling.
Yeah.
But once the ball rolls, then we know that healing is proceeding.
It is. It is. I'm just happy. I'm sorry. I'm just stoked because I'm stoked. I can't wait to get back in the water surfing again.
Praise the Lord. That's our goal.
Yeah. Praise the Lord. Amen.